Thanks
please.
so much for having me today. It's a real privilege to be with you. And so, when I was talking with Emma, we were sort of looking at what might be really useful for everybody. So, I am going to run through some sort of psychological support, what's specific to salivary gland cancers, and sort of hopefully help thinking around that. Obviously, ask questions. I'll make sure we've got time for questions at the end. So, first of all, my name is Elaine. I am a chartered psychologist and I specialize in what we call psycho-oncology. And that really means that I work with people who have cancer. Obviously, some cancers are more complex than others, and cancers that sit in the head and neck world are particularly distressing and cause trauma both in the treatment and in the post treatment, and can be really difficult to adjust to. And obviously, with salivary gland cancers, you are in a unique space in yourselves, and you are a rare cancer, and that makes it particularly challenging. It can be very lonely and very difficult sometimes to access the information you need to. So, this is a quote from a research study which was done qualitatively. And what's interesting about this was they interviewed people from all different types of cancers. Head and neck cancers were part of that process. And there were some really interesting narratives that came through. But I thought I'd start with this because this participant sort of said, I think it affects every aspect of my life. It's who you are. It's who I am going into the world. I don't think there's any part that's not touched by that. And for me, I think that's so powerful and important to hold in mind. Because I always tell people, cancer is not who you are, it's something that happens to you. But the reality is, there are times where it feels like it's everything and it feels consuming and overwhelming. And I think the greatest challenge sometimes is this idea that we get to go back to who we were before diagnosis. And actually, we don't. We have to almost grieve that person. And that adjustment is a really difficult process, and it's not quick and immediate. And I think it can be very hard for people around you to understand that or even grasp it, because they don't want to. They want everything to go back to normal just as you do. So I thought that was eloquently put, and I would start the session with that. And really, what I'm hoping is that we'll go through the stages of psychological adjustment. We'll consider the unique challenges that you face with your type of cancer and really look at how to adjust and learn to live with it. That's the hope, anyway. So there is an emotional toil, which I think is very different when you have a rare cancer. There is an isolation to it. It can be very, very lonely. You can feel hard to be understood. It can be really hard to even understand the cancer itself that you're experiencing or the treatment that you're having. And salivary gland cancer is rare. It's complex. There are multiple subtypes. It's roughly, 5 to 8, 6 to 8% of all head and neck cancers are salivary gland cancers. The exact cause is not fully understood, but it's one of those cancers where more research is needed. And because it's rare, there's less research done. And as a result, people often experience anxiety from a delay in diagnosis, or the diagnosis can be really uncertain. And there can be, like I said before, a lot of isolation because people just don't understand it around you. There's a lack of awareness. Mm-hmm. And with that comes the fear of progression, reoccurrence, and also the type of treatments that you have to go through, whether it's surgery or radiotherapy or radiochemotherapy or immunotherapy. There can be emotional trauma because some of the treatment is actually very aggressive. It's traumatic in itself. And I think the challenge is that you get told you're brave, you're amazing because you're doing the treatment, but very often you don't have much choice. And it's that difficult dilemma in cancer that there is no decision without risk. And very often the trauma of treatment gets lost because treatment has to happen. And you somehow have to survive it. You somehow have to get through it. And I wanted to bring this up because this is from one of Epstein's papers where, he's talking about the different stages of treatment and what you go through with oral cancer treatments. And the reason I I brought it up is I was kind of going back through some of the literature in preparation for today. And I came across this table, and this is just the oral complications. And I was looking at it and I was like, you forget, in the world of treatment, in the world of what's happening, how complex and how difficult some of the complications are. And this isn't even everything, it's talking about muscular pain, it's talking about saliva changes, neurosensitivity, infection, dental, periodontal, speech impacts, necrosis. But there's also, pain, chronic pain, sometimes just systemic pain. There's fatigue, there's cognitive fog, there's PTSD, so for me, it was just a real reminder of this is incredibly hard. You will be experiencing psychological distress because this is just some of the stuff that may or may not happen to you. And that's what makes this type of cancer really unique, because the intensity, the complexity of what's happening is very, very layered and difficult to always navigate in terms of managing side effects. And I'm sure some of you, unfortunately, have dealt with some of these things and are still dealing with them. And I think sometimes it's just important to remember the extent and the complexity. So some of this you may know because you have lived experience of it, but I do think it's always important to think about where we're at, the stages we're going through, so that we allow ourselves space and time, that we are compassionate, that we recognize that what may feel abnormal is actually completely normal to the context that we're living through. Diagnosis, we know, is a very challenging period of time because the shock of it is not something that we process quickly. Generally speaking, it takes approximately 6 months to get our head around a cancer diagnosis. A lot of people will have had treatment by that point, and some of that treatment will have been aggressive, will have been traumatizing. And so it's very, very hard to process that. And I always say during this diagnostic and treatment phase, we very much go into survivor mode. We're not able to really process what's happening to us. We can't really adjust because we don't have the space or time to do so. And it's a challenge because if we step back and really thought about some of the things that were happening to us, some of the treatment, it would be really hard to get up and go into that hospital and have that treatment again, or to be able to make ourselves go into a consult. So our brain protects us. That shock shuts down, we disassociate slightly so that we can actually survive, we can actually do the treatment. And with that, there can be a lot of fear, a lot of confusion. It can be a very destabilizing time. It can feel that things aren't going to shift or change. For most people, once they have a treatment plan in place, that does begin to contain some of those more difficult feelings. As we begin to have a purpose, we begin to have a way of dealing with things, and that makes it a lot more achievable. But the treatment itself, it brings physical aspects to it, which are very challenging. We experience stress physically, mentally, emotionally. And with that, there's a lot of fatigue and a lot of loss of control. And around these stages, what becomes evident very, very quickly is how you were doing generally in life before all of this happened. So we know from research into trauma that the more resilient, the better, the better we are, the more things that are going in our favor before a trauma event happens, the better able we are to manage it. So during this time, if there were any pre-existing stresses, relationship difficulties, work issues, family challenges, financial concerns, this is going to really elevate that. It also means that if you have any previous trauma events in your life, they may actually come back and you may experience some re-traumatization. So childhood trauma, traumatic events such as significant loss, or even something like a car accident, you can find that lots of those experiences can be re-triggered during this phase. And it can be very confusing because you don't always quite know why or what is happening. Trauma is sometimes a visceral response, which means we're not always able to verbalize it. But I do think it is, if possible, a really important time to open up communication with the team and let them know if you have any pre-existing challenges or difficulties. Even if, you know, that mental health episode was 20 years ago and it hasn't caused you any problems since, it may do. And if we know, we can do more to help you through that. Or say you experienced some level of childhood abuse. Actually, the team knowing that means that we can adapt and contain and support. But obviously, these are difficult things because sometimes we haven't dealt with those previous traumas. And it's only during this diagnostic treatment phase where we're feeling out of control, where the things that used to keep us safe that we've brought into play are no longer functioning. If we're lucky and life has been good and we enter diagnosis in a really good place, we are more able to adjust. The trauma effect of what is happening to us is reduced. So it's a hard time to always identify what is going on. And our brains don't particularly help us in that regard because they do tend to disassociate, which helps us get through it. So if we can, we try to reflect, hopefully engage with services during this time. But for most people, it's actually in the post-treatment phase that we see the highest level of psychological distress. It's post-treatment where less things are being done to us. Maybe we've got some good news about the effectiveness of treatment. Things are less evasive, but it's also the time where we begin to have to adapt to the things that the cancer and the cancer treatment have done to us, that we begin to figure out what we're going to maybe rehabilitate from, or maybe we're beginning to find out rehabilitation ceilings, or maybe we're even recognizing that, say, for example, our speech is going to take a lot longer to reestablish than we have first thought, and maybe it's not going to quite be the same again. So this is usually where we see a lot of grief. This is the time where we have to mourn who we were, maybe what we thought our life was going to be. We have to somehow come to terms with that loss. And people talk a lot about acceptance. And I'm never really convinced that acceptance is a good word, because I always feel like, why would you accept this stuff? It feels impossible to me. But somehow we have to make sense of it. And this is a really common period for anxiety and depression. The anxiety is often fueled by the fact that we might feel that teams have stepped back, the treatment has stopped. And depression is usually comes about because the enormity of everything we've been through begins to get processed. And this is a very difficult time, and it varies for everybody. And a lot of it really does depend on your rehabilitation, I would say. You know, what are those side effects? What are those treatment complications that you having to deal with? How is your rehabilitation pathway? And then the bit which I think gets maybe overlooked or, I don't know, glossed over is really this survivorship or this reoccurrence fear or this period of time. Because this survivorship, if you like, is a lifespan. It's not a single moment in time. It's this living with. And for most people, there is a hypervigilance. The health anxiety is at a level that you've probably never experienced before. We can also experience really high levels of re-traumatization during this time. The classic example is you suddenly see cancer adverts everywhere, or you suddenly see that there's fundraising events, or suddenly everyone around you is getting diagnosed with a cancer. That happens a lot, and it can feel so unfair. It's also that strange place that we find ourselves where we understand the nuance of the cancer we have, but other people don't get it. So people will begin to compare things when actually they're not comparable. And I think when you have a rare cancer, that can be very frustrating. It can make you very angry. So this period is challenging, and it's not a single period in time. Like I said, this is the lifespan. This is you living with, this is you hopefully getting back to a new normal, but having to integrate everything that's happened to you into your life now. And with it, there is the uncertainty. I always say when you get a cancer diagnosis, particularly a complicated cancer diagnosis, where, you know, not many people have it, limited research, not so many people to talk to, not so many narratives to engage with, there is this existential period where you have to cope with the vulnerability of being human. You have to deal with mortality. You have to deal with the uncertainty of existence. And this is particularly the case when you have a rare cancer, because you just can't get as much information as you would like. There aren't as many other stories that you can engage with or find as many other people on the same sort of pathway as you. So it's difficult. And what I quite liked about this piece of work is it's done by someone called Mullen, and he was actually a doctor who got diagnosed with cancer, and he realized through his own lived experience that he didn't really understand survivorship. He didn't really understand what his patients were going through, and so he sort of broke it down into these 3 stages. So he talked about acute survival, which is what I would kind of call survivor mode, which is just getting through everything. And this kind of extended survival. So this is when treatment sort of finishes and includes your sort of surveillance period for however long that is, and it might include additional treatments. And then he talked about this 3rd stage, which I think is, like I said, this more difficult thing, because it is this permanent survival. This is like the rest of your lifespan. And it's kind of vague. And it's if you're lucky, it's where you're cured, it's where you're managing really well. But you are still living with, you are usually still living with some consequences of everything that's happened. And it can be quite a lonely period. And hopefully, all being well, when you're in this stage, you have periods of time where the cancer is on the shelf. But for a lot of people, particularly with salivary gland cancers, there are reminders. It might be a visual cue in terms of the impact surgery's had on you, or it might be a little change in your speech patterns. It might be a bit of change in your cognition or your fatigue function. There are sometimes these daily reminders, which mean we don't ever quite get to walk away from it. And that's hard because usually in your life around you, lots of other people do. So you can be left with this permanent survival state, which other people can find hard to relate to. So, mental health challenges. Maybe I should just, are there any questions about anything I've said so far, or shall I keep going? Because I'm conscious I'm not in the room. So I can't.
Yeah, Elaine, I personally, I'd be tempted to say, let's keep going, and then we can have a proper Q&A at the end. Is that okay?
Perfect.
Someone else? I'm getting nods in the room. Thank you.
All right, I'll keep going then. Thank you. So the mental health challenges, the anxiety, the fear of the unknown, and this is where knowing yourself is really important. Are you a high anxiety, perfectionist type personality? In which case, this is probably going to be the area that you really, really struggle with. Or are you someone which already had quite a high level of health anxiety, and so this is going to get elevated now? Or is actually anxiety quite a new thing to you? Maybe you never really thought about illness or dying or what that might mean. And so actually it's quite challenging to now have to deal with some of these ideas or thoughts. Depression and mood changes, these can be complicated because they affect our families, our relationships, our working life. Were you someone who maybe was really high energy before, and that's not you now? And how do you adjust to that? Maybe there are things that you've had to change in your life. Maybe you can't quite do the job that you used to do before, or maybe your lifestyle has had to change a bit. And, body image and identity struggles, I think, are huge, because these aren't choices that we have made. These are choices that have been put upon us. And it's almost getting to that stage where we adapt and we adjust and we celebrate what we have and we celebrate what we can do and we celebrate our strengths. But it's not an easy process. And usually around body image and identity, this is where a lot of grief comes through. This is sometimes where people feel a lot of loss. The other challenge is PTSD symptoms. These can appear years after treatment. So we can see PTSD appearing sometimes 2 years post-treatment. It's not always evident that people are going to have PTSD. Again, it sort of goes back to what I was saying earlier. The better place we're in before a trauma event, the less likely we are. But PTSD is a struggle. It's when we're not able to compartmentalize. And it can sometimes be very, very challenging because family or friends can feel like you've suddenly changed, or you can feel like you were doing really, really well. You had, you'd got through treatment, you had adjusted, you were just turned back to work, and then suddenly you begin to experience PTSD symptoms, which can be things like sleep disruption, nightmares, flashbacks, almost like visceral anxiety responses. So you can start to have panic attacks. And sometimes they don't feel associated. And it's only when you begin to unpack, suddenly I can't drive, I'm full of anxiety. And initially, we may not associate that with the treatment that we've had or the cancer diagnosis. And it's only when we begin to unpack these things that we actually go, oh, do you know what? I know now why, because every time I got in the car, it was for me to go to hospital and have treatment. And I've become really sensitized to just that journey, to just that process. So it's always, I always say it's worth holding PTSD in mind, because you won't necessarily have the symptoms immediately, and you may not be seeing the mental health care professionals that you were at the time. You may not be engaged with your MDT, your healthcare team as often. But if you start to have things that just don't feel right for you mentally and emotionally, always worth thinking about PTSD. And then cognitive fog and fatigue. I think most people experience this, and it can be hugely frustrating, because depending on, you can go from having a really good brain where you didn't really have to worry about remembering things, to it being a struggle, and you have to scaffold, you have to deal with things differently. And this is where I think I always say, try not to work against yourself, but rather work with yourself. So this is where you need to be compassionate and patient with yourself and allow adaptation. And it's very difficult to sort of accept that it's all about the cancer and to blame all the cancer. But I always say we change as we move through our life anyway. Things happen to us. We constantly have to adapt. And yes, you may be having to adapt because of cancer, but none of us stay the same regardless. So it's trying to reframe some of the thought processes and some of the things that happen to us, so that rather than getting frustrated that we struggle to read or have the attention span, we just use audiobooks for the time being. It's fine. Or we put post-it notes by the front door if we're forgetting our keys and phone every time we leave the house, or we put reminders on our phone, or we recognize that we are tired, and maybe if we are, I know, doing a big thing at the weekend, we do need rehabilitation days, rest days, and that's okay. So rather than fighting against it and sort of spiking that anxiety, experiencing those depressive periods, we sort of set ourselves up to succeed. We scaffold things in a way that make us able to do things we want to do without experiencing such high levels of stress and frustration. The one thing which I think is very unique to the type of cancer that we're talking about today is the uncertainty. All cancers have a level of uncertainty, but when you have a rare cancer with the limitation of research, it kind of brings an unpredictability with it, particularly around progression. And, also the emotional cycle and impact can be very unknown. There's not a lot of research. There's not a lot of examples that we can draw on. There is some there, but we tend to collate it from many different types of cancer. If I was talking about breast cancer, it'd be tens of thousands of, studies on the psychological impact. It's not the same. And there is a uniqueness to what you go through. And that's why, the event like you're doing today, where you get to meet and to talk and to share, is so important, because it helps to normalize. It helps to take away feelings of shame or difference. And it also unpacks some of the stuff that maybe people are struggling with, but they haven't found a way to communicate it or share it. So the golden thing, the thing that all of us are always trying to work towards, well, in psychology anyway, is resilience. That's the sort of the golden apple at the end of everything. So the things that I think do help is, I do think it is helpful to seek psychological support where there's an oncology focus. And this can be helpful at different stages. I always say it's really useful to talk to someone at diagnosis, even if you're not going to have therapy at that point, just because sometimes that can signpost things that may happen along the stages. So if they do happen, they're normalized for you. You don't feel like you're going crazy, and you know that there is a network there to support you. And I think it is really important to look for techniques that address depression and anxiety symptoms. This is sometimes difficult because sometimes people might have had things they did before, and so they'll go to those, their usual coping strategies, but they may no longer work. So you may have to think of different things that you can do in different ways. And sometimes we don't want to do things. Meditation is a really good example. There is a huge amount of evidence that meditation is as effective as an antidepressant. And, it's a really good treatment for anxiety and depression. But not everybody likes meditation, and not everybody wants to do it, or people have an idea of what it should be. It doesn't mean you can't meditate. It's about how you adapt it. So you can have a meditation playing in your earphones when you go for a walk. It could be a minute a day. But something like meditation is going to be about daily, consistent practice. But it doesn't have to be an hour in complete silence where you have no thoughts running through your head. That's actually not what meditation is about. So sometimes it's sort of thinking, there's this technique, I know it works, how I'm being told to do it doesn't really fit with who I am, but it doesn't mean I can't adapt it. So really, we are looking for different ways to sort of support ourselves, to express ourselves, and help alleviate it. And everybody is different. For some people, it may be music. Some people, it may be a walk, or it may be watching a comedy show. Or it may just be saying to ourselves, yes, today is a day when I can't get out of bed, and I'm going to give that to myself. And maybe I'll allow myself a couple of days like that, but then I do have to get up. I do have to leave the house. And sometimes this can be really helpful to sort of share with family and friends, that they know what your techniques are, so they can remind you. They can go, you are going to leave the house today. I'm going to help you do that because I know it's really important for you. Or you're tired, but let's get dressed anyway. Let's put an audiobook on. Let's do something. And I usually say, try to do one thing that looks after your mental health each day. Just one thing. And it could be 5 minutes sitting in the garden. It could be doing a box breathing exercise. It could be drawing. It could be coloring in a picture, but try to do something which works for you. Because really what we're trying to do is activate our parasympathetic nervous system, which is that nice calming, soothing effect on us, and trying to help our brain switch off some of the hormones that drive our sympathetic nervous system, which is, the thing that triggers our fight and flight, that kind of gets us going, so that we are hopefully feeling more secure, more calm, more safe in the world. And it's okay to think of different ways to express your feelings. Talking is actually really difficult. It requires a huge amount of energy. During certain treatment stages for this type of cancer, you can't talk. When we're working with people, there are periods of treatment where we actually don't do talking therapy because it's too painful, it's too difficult. It would cause too much distress. But there are other ways that you can support yourself. And it is about thinking about that ahead of time, preparing for that, and finding out what works for you. Some people like writing, some people like drawing, some people don't like doing any of those things. They will play music. Some people will cook, some people will garden, whatever it is. Think of different ways that allow you to express who you are. The other thing which is really important is to think about reframing uncertainty, so that it no longer becomes a block, it no longer is a barrier, it's no longer a limitation, but rather it becomes a space where you can be flexible and you can grow. When you go through this type of trauma event, the one thing it does do is to pause everything for a moment in time. And that pause can actually be seen as an opportunity to really think about, am I living my life the way I want to? Am I putting the energy into things that have value to me? And giving yourself permission to change. Sometimes it's really hard to give ourselves an allowance to be something other than we are. But I think sometimes with uncertainty, there is also opportunity to do things differently, to explore different aspects of ourselves. I always say that we're not one person who has one life path, if you like. We can be many different people and live our lives in many different ways. And so, yes, maybe how you thought you were going to live or how you thought your life was going to play out isn't going to be, but that doesn't mean there aren't other ways that will be valuable and joyful for you. So, trying to reframe uncertainty into an opportunity, easier said than done, I think sometimes helps to help you feel more in control, to bring hope back into our mindset. So, navigating the uncertainty, I think something that's always really useful to sort of think about is to normalize not having the answers, to really go, yeah, I'm not expecting to know that. I understand that my oncologist may not be able to give me those answers, my surgeon may not, but together we're going to work as a team, we're going to collaborate, and we're going to find a way through this. We're going to have a conversation. Again, depending on personality types, this is easier for some than others. If we are used to being able to solve problems, we're used to being in control, this can be a very hard thing to adapt to. However, sometimes it's really, really helpful, because if we were always used to being able to solve things, we were always used to being in control, it hasn't ever left much scope for us as people to fail or to be helped, to be supported by others, to abdicate some of our responsibility. And sometimes we find that actually it is quite nice to be held by others, to have other people solve our problems, to hand over some of that responsibility, and that we can surprise ourselves. So sometimes this is about developing a new skill set that we haven't developed before. So rather than maybe being the one to solve all the problems, we develop a skill set where we become good at delegating, we become good at allowing others to help us. The other thing which I think is sometimes useful, particularly when we are surviving, when we are living with cancer for a long time, is to be able to distinguish between acute phases and chronic phases. So acute phases to me are when we're in really active treatment and lots of stuff is being done. And chronic phases are where maybe we're managing some side effects, or maybe we are still on some treatment, but it's not disruptive to us. And it's sort of recognizing that cancer isn't always this big, scary thing. There are moments where it's big and scary, but there are other times where we are just ourselves and we are just living life and we are just getting on with things. Doesn't mean it's all over, but it means we are sort of managing it better. And the reality is, cancer treatments are getting more sophisticated, more effective. We are better at minimizing traumatic effects from treatment. People are living longer and longer. So this management of chronic presentations is actually quite complex. And that's when maybe I feel, and people can disagree, that the medical system is probably catching up, because we tend to really focus on the acute stage, and the chronic phase can be quite complicated, because you might need a pain management specialist, you might need physio, you might need a dietitian again, even though you thought you had it all sorted. And trying to sort of coordinate teams around, or even feeling heard, I think is really challenging sometimes. About, do you know what? Yes, I had treatment maybe 5 years ago, but I'm still really, really struggling with this. And how can I get some coordinated care for that? So that's, one of the outcomes, I think, of us getting better at treating cancer is that more people are living with side effects of treatment. So even when dealing with the unknown, I think it's really important to remember we have choice and we are empowered. It doesn't always feel like that, but if we can hold in mind that we do have choice, that we are active in the things that are happening to us, it helps to give us that sense of control again. Very often the areas where you see this the most are with things like physio or diet management, routines, getting back to work. And, it feels good to be in control. It feels good for us to re-establish some certainty. So trying to think, yes, there may be things that I am uncertain about or I don't know about, but I do still have choice, and I can choose to normalize not having the answers. I can choose about how I approach my pain management. And just remembering that when we are at our most vulnerable as a patient, there is a lot of doing to us but it's really important we do take back that control and power. So the other thing which I think sometimes gets lost when we're thinking about uncertainty is thinking about what anxiety and depression look like for you, because it doesn't look the same for everybody. You can have people who are what I call functioning depressives, in the sense that they go to work, they pay their bills, they do everything we think a functioning, happy, content person does, but they are deeply, deeply depressed and unhappy. The same can be for anxiety. Anxiety is sometimes harder to actually see in another person, because society tends to reward anxiety, because if we're anxious, we tend to do stuff. So that's where you have to be really honest and really reflective about what does anxiety and depression look like, because the chances are you will notice those shifts before anybody else does. Sometimes actually that's not true, because sometimes it's other people who notice it before. But for a lot of people who are highly functioning, they're the ones who notice it. People around them wouldn't have a clue that they were having the worst day of their life. And, you know, the other thing to remember is that even when we are in our darkest place, that moment passes. Even when we feel it's hopeless, the next day it won't necessarily be. So just sort of working out what causes your anxiety, what causes your depressive episodes, what does it look like, really, really helps you to know when you need to get your toolbox out. And I really advocate that everybody has a toolbox for their mental health. And by this, I mean that you know what techniques, what things help you. Is it, I don't know, a weighted blanket on the sofa with your favorite essential oils, listening to your favorite audiobook? Or is it going for a walk with a friend and having a cup of coffee? And these are not easy things, because sometimes what maybe was a really useful thing for us and it did sit in our toolbox is maybe not as accessible. So maybe we used to love going out and eating with friends, but because of treatment, we're really self-conscious about our eating, or maybe we can't eat in the same way. And we have to adapt to that. We have to let go of things and we have to find other ways. So, you know, maybe we take food that we can eat with us, or maybe we explain to people how we've changed our eating patterns, or maybe we just go, we're going to go for that walk rather than that meal. We find other ways of adapting. And that can be very, very hard, but you do need a toolbox. And also you need to recognize that your toolbox may change depending on where you are with treatment and depending on where you are with recovery. The other thing which I think is very hard when you're dealing with uncertainty is thinking about decision making. I always say try to break it down into manageable steps. Generally speaking, when we're making a decision, we have to acknowledge that we can only make the decision with the information that we have in the moment. We know that actually making a decision is more important in terms of effective decision making. And when we look at human beings, they tend to make really good decisions in terms of what they know at the time. We're pretty good at it. You know, our brain is constantly assessing for risk. So it is sort of maybe trusting yourself, having that faith in yourself that you are making the best decision in the moment, and try to break it down. So you're like, you know, I can't make a decision about something in 5 years' time. I can make a decision about today or this week, and that is good enough. I'm going to stay in the moment as much as possible. And we've talked about this a lot. So it's grieving the loss of what was known and expected, and sort of allowing that to sort of shift and change. And generally speaking, when we get to that point, it actually makes the decision making, it makes the living with uncertainty a bit more easier to manage. And again, just accepting that emotions will fluctuate. They will change. You know, you will go through various emotions in a single day, a week, a month, a year, and that is normal. You know, whatever your emotional state you thought it was, it's okay if it changes because you're going through something extraordinary. And this sort of ties back to what I was saying about thinking about how anxiety and depression looks for you. And then when it comes to sort of decision making, you know, think about what you need to help you with that. Think about your support network, you know, working with the MDT, understanding the risks versus the benefits, thinking about life quality in that equation. And if it helps, utilize second opinions. I think that's always something that sometimes people are hesitant about. But if that's going to make you feel more comfortable with what you're doing or what you're engaging with, that can be a really positive thing. And then patient advocacy really supports shared decision making. So it's that feeling that you're not being done to, you're collaborating with decisions that are being made about your body, about long-term outcomes for how you are going to function and feel. So, life during and after treatment. There are sort of areas that you have to focus on. One of the most dominant is obviously the physical recovery, and you're very dependent on usually other healthcare professionals, but also family and friends in terms of supporting you through that. One of, I think, the key factors is really finding ways to manage the side effects. And this is where I think making sure that you're feeling heard, really establishing your voice and really advocating it, or having someone who can advocate for you, is hugely important. Because the type of cancer treatment you're having and where you're having it in your body, the side effects are hugely difficult and problematic. That's, like I said, nerve damage or dry mouth. And these side effects can really impinge your daily life quality. And that's when we begin to see the depression and the anxiety becoming problematic. So finding ways to access or find ways that will help you. And if something doesn't work, being really honest about that it's not working. And maybe, hopefully today you're talking to people and getting ideas about how to support yourself with these side effects. And sort of accept that it's okay if you need to have speech and language therapy again. It's okay if you need some more physio. It's okay if you need to use pain management, and really do so, and not feel that you have to just cope and manage. And sometimes what people share with me is they feel a lot of guilt. They feel like they should be so grateful that they've survived, that they feel they shouldn't complain. And I sort of feel like, well, actually, these are really difficult symptoms. It's not complaining. It's saying, I'm really, really struggling, because maybe there is something that can help you. Maybe it is about if the pain isn't being well managed, what else could be done? What other things can you maybe look at? So recognizing that all of those services should still be utilized. And then obviously long-term monitoring and how you engage with that and how you incorporate that, and sort of reframing that into a positive rather than a negative, but also accepting you will have a lot of anxiety around any point where you're going in for a scan or a consult. That's perfectly normal. I always say you have to accept that, meditation isn't going to deal with that level of anxieties. Best thing is usually distraction. That 24-hour period before you have a scan, before you go in for a consult, keep the diary busy. Don't book anything in that week that's of significance to you. It's not a week where you want to be making big decisions, because emotionally it is going to be a roller coaster. That's what we would expect. So moving from treatment to surviving and living with, there are a couple of things which should be proven to be really helpful in terms of that sort of medical psychosocial model. The focus model, which you may have heard of not, has been shown to reduce feelings of hopelessness. And I think you'll see there's a theme with all of these thought processes, in that it's all about empowering. It's all about helping you feel more in control. And the focus model stands for, it's an acronym, so it's family involvement, optimistic attitude, coping, effectiveness, uncertainty reduction, and symptom management. And that it's this idea that you do sort of work through where you're at in terms of looking at these areas and thinking, what can I do? What goals can I establish? How can I make sure that the communication is happening? And I think, bringing family members to consults, encouraging people to educate themselves so that they can be present with you, allowing yourself permission that you do need people to adapt, that it's okay that you ask things of other people in your life. Optimistic attitude, that's sort of connecting back to what we've already talked about. Easier said than done, I think. But like I said, I do think if we can get to a space where we see opportunity within uncertainty, and we see a way to navigate for maybe improving things in our lives, even if it's just, I'm going to take this opportunity to have a bit more time with my loved ones. to have a bit more fun. Do you know, I hated my job, don't know why I was doing it, so I am going to change it, things like that. Or I'm going to talk to my manager, see if I can adjust my hours. Coping, developing those coping strategies. Effectiveness, it's the idea of sort of setting goals, of setting things that are helpful to us and making sure that the interventions we're having and what we're doing are actually useful to us. And then hopefully focusing on this uncertainty reduction. And we've talked a bit about symptom management. So I always say have a rehabilitation plan. I think you should actually have a prehabilitation plan as well. So I always really encourage people, you know, have a consult with people before you have surgery, for example. So at that diagnostic stage, like I said, if you can, speak with a psychologist, maybe speak with a dietitian, maybe speak with a speech and language therapist, speak with a physio. What can you prehab? How can you prepare yourself for some of the treatments coming up? But equally important, have a rehabilitation plan. Establish your needs and goals with your medical team. Think about your support systems and think about how your interactions can become productive. So this is where you really are thinking about what you're working towards. How can it be achieved? Who can support me with that? And recognizing that rehabilitation is a long process. It is a lot longer than treatment itself. Psychologically, it takes, I would say, for non-complicated cancers, about 2 years to psychologically adjust, to use that word adjustment. I think for cancers which are more complex, which salivary gland is, it takes a lot longer. I wouldn't necessarily expect to see psychological adjustment in that period. I might expect to see it a lot longer because there might be body image issues, there might be speech and eating difficulties, there might be other factors which mean that some of those symptom managements are going to extend out psychological adjustment and symptom management. And then we know that promoting self-management really supports transition from primary treatment to survivorship. So this is where we regain our power. The worst thing I think sometimes about being a patient is that it robs us of our confidence because we are suddenly vulnerable almost overnight. And we can go from being someone highly capable, able to manage everything, to feeling very scared, very vulnerable, reliant on other people for our survival. And it's terrifying. So trying to get to a stage where we actually do become more empowered, we do take more control over our daily routine, over what's happening to us, we know really, really helps in terms of regaining our identity. So, whoops. The importance of hope. So here, hope, I think, is so powerful. It's usually really underestimated in terms of how we think about things. But we need, as human beings, we are designed to survive. We are driven to make purpose and meaning. So really kind of rediscovering that or reconnecting with it. And like I said, you may have to redefine what that is. So it's not necessarily a straightforward thing, but somehow thinking about how you can create legacy, how you can create meaning from the trauma. And obviously you're here today. And so, you know, just the fact of you being here today, I would say, is that you are all doing this. You are all taking part in making meaning from the experience that you have been through and are going through. And, you know, there are different ways that people do this. It doesn't, you know, some people do the volunteering and the advocacy, but it could also be, like I said, you know, I've met people who always wanted to learn the piano, for example, and how they make meaning from the trauma is that they give themselves permission to go and learn the piano. Doesn't have to be a big thing. Or someone else I can think of, it was a bit ironic because they struggled to eat bread, but they decided they wanted to make bread. So there are different ways that people go about making legacy. There's not a right or wrong way, but we have to find our purpose. We have to reconnect with ourselves. We have to establish life. You know, you can't live if you spend your time thinking about death and thinking about illness. So somehow we have to find a way to make sense. A lot of that does help. You know, it's the telling and sharing of stories. Even if you're coming to see someone like myself, you know, what we do in sessions is we are telling stories. we are helping our prefrontal cortex engage and process trauma through storytelling. So having those conversations with friends, and it doesn't have to be about the cancer, it can be about other things, but it's re-establishing your narrative. And with that, we tend to find we begin to redefine what success looks like, what strength looks like, what good looks like for you, sort of accepting that we change, and that even though the diagnosis may have altered your life trajectory, it does not mean that you cannot create a life that has meaning to you. And yes, you know, to get to this good stuff, there's going to be a lot of anger, a lot of frustration, a lot of pain, suffering, loss. But there is a trajectory, is what I'm saying. We can work through that and adjust. And it's not easy, and it's not pain-free, and it's not without hard work and sadness. But that's where hope comes in. It's the hope that however difficult today is, tomorrow will be better. So final considerations, and then I'll allow, hopefully we still got some time for questions. So, I mean, I'm a psychologist, so obviously I'm going to say this, but I do think psychological care is as important as physical care. You know, I always say that your medical treatment is what enables you to live, but it's your psychological state which gives meaning to your life. You know, that's the reason that you do treatment. So taking care of that is hugely significant. And sometimes it's complicated and messy because, like I said, you know, maybe stuff has happened to you and you haven't ever taken psychological care of yourself before, or you've never really thought about depression or anxiety. It's always interesting to me how many people I meet at a time when they're having a depressive episode because of cancer treatment, that when you're talking to them, you know, I'm sort of thinking with them, they've probably had cancer since they were a teenager. No, not cancer, sorry. They probably had depression since they were a teenager, but they've just never really thought of it in that way. And it's only reflecting back that they've realized they've actually been struggling a long time with their psychological health. And it's only having the cancer that has allowed them to explore that and acknowledge it and actually get it treated and get help with it. So that's sometimes an odd positive outcome of having a cancer diagnosis, is that you do begin to take better care of your mental and emotional health. And then, you know, recognize that you're not alone and that there is support available. And I mean, everyone here today hopefully recognizes that, because you're here amongst people who are experiencing a similar experience. But in those moments where we feel hopeless, it's recognizing that there will be someone to help us. We just need to find that person to talk to, or find that person who maybe is going to understand us. And then this, I think, is really important, that it is the small steps we do every day that have the biggest impact. That could be something as simple as doing exercises that your speech and language therapist has given you, or it could be following the advice from a dietitian, or it could just be walking out the front door, having a look around and walking back in again, or getting out of bed and sitting in a chair, or doing a couple of minutes of meditation. So if we can just in our day build a couple of things that help us, we are sort of building those behaviors which longer term are going to take really good care of ourselves. And we can do it because, you know, we automatically, for most of us, brush our teeth every day. That's a behavior that's been ingrained in us in childhood. So maybe can be other behaviors that we ingrain in our habits. So without too much effort, we are taking care of our mental health each day.